So if you go to our website, you'll see underneath common conditions, forefoot pain. So if you click on it, ball of foot pain, which is commonly like most people describe it. The clinical name is called Morton's Neuroma. So what is it? Morton's is just the name of the guy that named it. Neuroma, meaning increased thickening of the nerve. Another technical name for it is interdigital neuroma, or intermetatarsal neuroma. However, I like to refer to it as times as digital nerve entrapment. Digital nerve entrapment. And over a long period of time, this nerve becomes thickened, the tissue around it, which jams itself in between the toes, and it causes the nerve to be squeezed, and it becomes very, very painful. It's very common between the third and fourth, but also happens between the second and third. It's often very, very painful. So people normally describe of pain at the bottom of the actual foot. The cause is not necessarily always clear, but a lot of times it is related to poor footwear or tight-fitting shoes or high heels. And there is a lot of burning pain and shooting pain around the ball of the foot, and sometimes even numbness and tingling around the actual toes. So Morton's neuroma, as you can see here, we put it into Google. It is the nerve as it thickens or swells because of the pressure. Just as you get callus on the skin, you can also get callus or thickening of the tissue around the nerve, which then entraps itself in between the bones. And because there's not a lot of space between the second, third and fourth, you don't commonly see it in the first and second, which is in between here and here. Most of the times we see it in between these two bones or these two bones. So I'll show you another photo. That's probably a better photo. So we don't normally see it in between these two because there's a lot of space there, mainly between the second, third and fourth. And because the nerve has a lot of pressure, the nerve tries to protect itself by putting surrounding itself with a layer of skin. That's what we end up calling a neuroma. Eventually that will end up growing and jamming itself in between the bones, squeezing on the actual nerve, making the ball of the foot very, very painful, and even numbness around the toes. Another symptom that we do see is that the toes will start to separate because of the actual swelling. So some people describe, I'm getting a lot of pain, I'm realizing that my toes are separating. There's another example there, sort of a smaller picture, how the toes, because of the swelling of the nerve, can separate. So a lot of times, and you've probably seen some photos of some surgical pictures, that there are times where this gets so large that it does require surgical interventions. However, there are other ways of treating. So if we just go back here, let's go back to the top. All right, so Morton's neuroma is not actually a tumor. This is something very, very important because people see the word OMA, all right, which in Latin is a type of growth. So if we just put that, here's a little bit of Latin terminology. So OMA is a name for tumors and masses, right? So you hear, for example, a lot of cancers, they will end with OMA, which means a tumor. But in this regards, we're referring to it as a mass. So it's nothing that's cancerous, or it's not even considered to be a tumor, but a thickening of the tissue that surrounds the digital nerve leading to the toes. All right, and the thickening can lead to various levels of pain or discomfort in the forefoot that limits the ability to perform certain activities. Pretty much you're in a lot of pain. That's pretty much. And the feet in the toes become numb. Sometimes you get shooting pain. Sometimes you get pain shooting down the leg. Sometimes you get pain shooting up the leg. It gets really ugly at times. A lot of times in the very early stages where it hasn't developed much, very hard to pick up on ultrasound, X-ray, MRI, and all those things. Now, how is it treated? That's the most important thing. Now, because these bones squeezing on the nerve, we have to separate these bones. We have to open up these bones. And the way that we do that, so if we go here, we type in metdome, the way we do that is something that we refer to as a metatarsal dome. Okay, this goes under the foot, behind the met heads, right? So behind the joints of the foot. And what that's designed to do, so there's an example of one that they stick on. Normally we actually attach it to an orthotic, but what that's designed to do, see how it's sort of back? It's designed to open up these spaces and relieve the pressures of the actual nerve. There's another example there. If we scroll down here, there's another example of a dome. So generally these domes that are placed onto the orthotics, they have to, at times we have to correct the position of the arch and the metatarsals, and it has to be in the right spot. It has to be in the correct spot for it to work effectively and efficiently. So that's one form of treatment. Another form of treatment which actually works quite well is prolotherapy, which is a type of injection. So if we go over here, prolotherapy injections, which is either a glucose or saline injection, and the treatment can help restore the stability in the foot and prevent hypermobility and prevent the pressures of the bones exerting onto the actual nerve. So it's used as sort of strengthening the structures around and reducing hypermobility, so to prevent hypermobility. Also there is PRP, so platelet rich plasma injections can also help. There is cortisone. There are some reports of people having cortisone, but a lot of these, even we see here, look, prolotherapy is a new treatment for Morton's neuroma. Generally we find short-term, so a lot of these will have short-term effect. Generally, like we said, the treatment of Morton's neuroma, the best way to actually treat it is to treat the cause, which is the squeezing of the actual bones on the Morton's neuroma, on the actual nerve. And the best way to do that, like we said, and without sort of any side effects or anything like that, is a metatarsal dome on an orthotic. All right, so the example of an orthotic metatarsal dome, and a lot of times we like to customize them for reasons being that we like to support the metatarsals, we like to support the midfoot, everything in the aligned and straight position, and have that metatarsal dome in the right position. There is sometimes off-the-shelf options that we can sometimes try if patients feel that's the way they want to go. But generally there's another example, looks like of a custom orthotic with a metatarsal dome there. So yeah, it is actually easy treated, believe it or not. It's probably one of the easier conditions to actually treat. However, it is a progressive condition. So the Morton's neuroma can start off first it actually doesn't even start off with anything, it just starts off as just a pinched nerve. If you really get it in its early phases, it actually works really, really well. And as it progresses, like I said, sometimes it gets so big. Unfortunately, so that's an example of the Morton's neuroma there. Unfortunately, you have no choice but to actually, there's an example. So that's actually growing around the nerve. You can see the toes, how separated they are. You have no choice but to surgically remove it. So generally, again, if you get pain between the toes, pain towards the bottom of the feet, sometimes people describe walking on like a hard pebble or a stone, numbness between the toes, get it checked out. It does require an assessment, and hopefully, we prevent it from getting worse, and hopefully preventing surgery.